Good morning. I'm Maria Paz Grisales, a PRM specialist from Colombia and vice chair of the PRM Youth Forum. Today we have the pleasure of interviewing Dr. Abena Tannor. Dr. Tannor is the director of the first locally led multidisciplinary rehabilitation medicine service in Ghana. She has been invited as a keynote speaker at the upcoming PRM Congress in Cartagena, June 4th to 8th. Hello, Dr. Tannor. How are you today?
Hello, Maria. I'm fine. How are you too?
Fine, thank you. Have you been to Colombia before?
No, this would be my first time and I'm really looking forward to it.
Okay, and what are you especially looking forward?
So I'm looking forward as I have actually looked forward to in previous ISPRM congresses, looking forward to meeting other PRM physicians, learning from those who have spent or who have quite a lot of experience in the field. Also sharing my experiences in starting PRM in Ghana and the training, and obviously going around and looking at how beautiful Colombia is. Yeah.
Okay. While I was reviewing your accomplishments, I found a 2009 report by the International Rehabilitation Forum that stated that in that time there were only 6 PRM physicians in all sub-Saharan Africa, and it said all of them were living in South Africa. Here we are 14 years later, and you're running the first locally managed rehabilitation center in Ghana. What do you think are the most important factors to bringing about such a change?
So it is true that for a long time, for many years, there hasn't been the training for PRM physicians in sub-Saharan Africa. Yes, in some other countries over the years, countries like 𝐓𝐫𝐚𝐢𝐧𝐢𝐴, Congo, other countries have started training, mostly the French-speaking countries, but in the English-speaking countries, there haven't really been any progress. But that is what we are looking forward to change. So in Ghana, the idea was to be able to show that or be able to start that training so that persons with functioning difficulties or disabilities could also access that kind of service. And I think that 14 years later, there has been some improvement in sub-Saharan Africa. There's a lot we can do, that I have to state as a fact. There's a lot that can be done. There are some modifications that can be done to the training, or innovations that can be implemented so that people can have access to PRM services. Yeah.
Why do you think rehabilitation is not usually a priority for governments in low and middle income countries?
I think that stigmatization plays a very big role in sub-Saharan Africa, or let's say in Ghana, for example, and people do not value the contribution that persons with functioning difficulties could make to the economy, and the fact that there's a lot of they don't weigh the economic impact of having to care for or having to use government funds to cater for persons with disabilities or functioning difficulties. So that has been one of the things I think that probably governments fail to see. But in all of that, I think that it's the awareness creation on the importance of rehabilitation. I think that there's a lot more that can be done in terms of advocacy, in terms of being able to showcase the importance of rehab and how people's lives have become better with access to rehab.
Okay, thank you. Your session at the next Congress is training PRM physicians in low and middle income countries. Can we do things differently? What are the main challenges in training PRM physicians in low and middle income countries?
So I think that first of all, having the support, not only in financial terms, but having government support, having support for managers of health facilities to release doctors who are interested in training, for the training, and also to sponsor their training as well. That has been one of the major challenges in training. And then also having the experts or the trainers within the countries to be able to provide the training. Again, there are no established programs. So the fact that there are no established programs actually also has been a challenge. So if a doctor within a country, a low to middle income country, is interested in becoming a PRM physician and there's no established training, meaning who is going to train that person unless the person leaves the country? And most of the times too, that proves as a challenge, because where are the finances to travel outside the country to go do the training? Some also go, and probably because of better living conditions do not want to come back. So all these come in as challenges to training. And even when the training has started, in certain cases where training has started, for example in Ghana, sometimes being able to coordinate a team that would work together as a rehab team to provide the service has been difficult. And also, again, having people around to monitor and to provide the training. So these have been some of the challenges.
Okay. I was wondering, as a challenge also, that most of medical evidence related to rehabilitation is usually generated in high resource settings, usually in high income countries. How do you believe we can apply that evidence to low and middle income countries, especially in low resource settings?
Yeah, so that actually points to the fact that there needs to be a lot of research, and there needs to be a lot of publications on the things that are being done. Exactly as you're saying, the evidence behind everything about training comes from high income countries. And that's actually the main goal of this keynote address, to be able to showcase that things can be done differently. We need to look at how can we innovate, how can we train or find another way of training, especially in countries where there are no PRM physicians to be trainers. How does the training then go on? Again, we need to also look at improvising in terms of the equipment that are used for training, the items, the products that supplement the training. How do we find ways of getting the trainees to have access to these things so that they can also experience how these things work? And then also looking at the way PRM training is, the kind of health conditions that the services are provided for vary greatly with amongst countries, especially the kind of health conditions I would manage in Ghana varies from the kind of health conditions that rehab will be provided for in high income countries. So we need to consider all these things because they are sort of different, and also the perception or the attitude towards PRM or rehab in general, even from colleague physicians who may not really understand the role of PRM in their management of their patients. So these are some of the things that come in and sort of challenges or differences between low to middle income countries and high income countries.
Okay, thank you, Doctor. Finally, I would like to know if you could send a message to all PMR teachers, residents, and physicians who live in those countries, what would it be?
So what I would say is that it is possible to start PRM physician training in your country, but most of all, you need someone who is dedicated. If you are there, you feel that within your country there's no PRM physician training, you are interested in starting a training like that, and you're passionate about it, that is the first step that is needed. And then we need to look at how best the training can be established, looking at examples from other low to middle income countries. And then lastly, I think the global PRM community needs to understand that in order to serve persons with disabilities and functioning difficulties in low to middle income countries, we need to train more PRM physicians, or we need to train PRM physicians in low to middle income countries. There are challenges, but those challenges can be overcome if we innovate, if we think of different ways, different channels of establishing training programs. And I think that in the long run, we will not leave the low to middle income countries behind, and everyone everywhere, including low to middle income countries, persons there can access rehabilitation. Thank you.
Thank you so much for your time, Doctor. I would like to invite you all for the keynote speak from Dr. Tannor in the ISPRM Congress in Cartagena. Hope to see you soon there.